are you, Michelle?
Yes. Hi.
Hi. I'm Rachel. I'm a student nurse, and my instructor has assigned me to observe you for today.
Okay.
So, can you give me your report on your patient?
Sure. We're taking care of Glenn Lai. He's in room 619. He's a 67-year-old male.
Okay.
He's a full cold and he has no allergies. To talk about him a little bit, he was admitted today with a complaint of an increased blood glucose, reading in the 300s for the past 5 days. He has a non-healing wound in his right heel. Then he noticed approximately 2 weeks ago. He tried to treat it at home with salt and water, but he wasn't successful. So that's why he came here. He is a 20 years diabetic. He's a type 1. His A1C was 6.5%. It's a slight increase from 3 months ago. His last assessment reveals that his blood pressure is 128/70. His pulse is 76. His respiration 16. His O2 is 96%. His blood glucose is 290. And he has an IV line in his right forearm. And in his skin, he's a stage 2 ulcer in the right heels. But the other integumentaries are dry, pink, and warm. He has a dressing 2 times a day for the wound. And we have a team to look at his wound. It's odor. His respirations are clear and auscultation in all lobes. He's non-smoker. For his GI and he has active bowel movement in all 4 quadrants. His abdomen is flat, symmetrical, and soft. He denies any dysuria or problems urination. His cardiac S1 and S2 are regular, rate and rhythm. And but his father died at age 53 with a heart attack. His narrow eyes and ears. He's alert and oriented times 4. He has Perla. His nerves 2 to 12 are grossly intact. His musculoskeletal is 5x5 on strain. He's a low risk for fall because of his wound and because his diabetes, for the diabetic neuropathy. That's about it.
I have a few questions for you here. Why specifically is this client receiving this medication?
Because he's a type 1, so he don't produce insulin.
Okay.
So that's why we needed to give it to him.
What action does the medication have on the body?
The insulin helps the glucose move to the cell.
Okay. When should you question administering this medication?
If he do not eat, or if he having any side effect. It's just more, if the glucose is less than 70. So.
Good. Does the medication have a therapeutic serum level?
No.
Okay. Which vital signs must be monitored?
We pretty much monitor all vital signs, but we just make sure the fever and the blood glucose is the most important. We check it before meals and at bedtime.
Okay. Which physiological parameters should be monitored when the medication is being administered? You may have already answered that, but...
The blood glucose.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
We try to make sure that they will let us know the signs, if they have any signs of hypoglycemic, so we'll tell them if they're feeling clammy, sweating, all those, to let us know. Just signs and symptoms of the medication.
Okay. What interventions must be taught for taking the medication safely at home?
We want to make sure that they, how they storage their insulin, they don't have to clean the site with alcohol like here in the hospital we'll do, but just make sure they clean with water and soap. How to draw their insulin, how to apply the insulin itself, to not apply the same site every time.
Okay. What are the side effects or potential adverse reactions?
That would be hypoglycemic, or when they apply at the same time. All the time is the lipotrophy and anaphylation.
Okay. How will you know the medication is effective?
If we got a good number for the blood glucose levels, which is in the range.
Okay.
Okay. Is any more questions do you have? And I also print for diabetes from the association a diet because the client asked us to.
Okay.
So that's what I'm gonna teach him about the diet.
So I'll just watch you administer it.
Okay. Let me just wash my hands here. Let me go in.
So I got my order. Here's my insulin here. I'm gonna go ahead and pull it. I'm gonna check.
Hi, Mr. Lai. How are you today?
Good. How are you?
I'm Michelle. I'm going to be your nurse today. I also have a student with me, Rachel. It is okay with you if she wants?
Yes, that's fine.
Okay. So how are you today?
Oh, I'm all right.
Okay, so I'm going to just wash my hand. Can you tell me your name and date of birth, please?
It's Glenn Light. I'm 67 years old.
Okay. And I'm just making sure here. It's going right, 67. Do you have any allergies?
No, I don't.
Okay. And I'll make sure here he has no allergies. Have you taken insulin before, Mr. Lane?
Oh yeah, for 20 years.
Okay. We check your glucose before, and it's in the readings of 2.9, and that's why we're going to give you the insulin.
Okay.
So I'm going to check that is the right medication with MR. And it is. Okay. Then I'm going to check in. Okay. Can you tell me your name again and your date of birth, please?
My name is Glenn Light. I'm 67 years old.
Okay. How we don't have the scanner, we need to type.
Okay.
And you also know, can you tell me the signs and symptoms of hypoglycemic, please? Then I told you last time.
Yeah, if my sugar is low, I know I'm really looking for like any clamminess. That's the one that I'll know right away. Maybe dizziness.
Okay. How are you feeling now today?
Feel pretty good.
Okay. Did you have you eating today?
Yeah.
Okay. And I saw then your food. It's you order your food and your food's coming because how we're gonna give you the rapid. You need a meal right after. Okay.
Okay.
So we're giving 6 units. Rachel, can you verify for me, please?
Yes, 6 units.
Go ahead and check it again.
Okay.
So we're across 6 units.
I'm going to check one more time, and I'm going to check for the expiration date, right time, right dose, right patient. It's clear and looks good to me. I'm going to clean it.
Mr. White, I have your insulin for you. You said you wanted it in your tummy.
Where do you usually take your insulin, Mr. White?
Usually in my stomach.
Okay.
Now, can you tell me your name and date of birth?
Last time, where do you?
In the top of my stomach.
In the front?
Yeah.
Right or left?
Right side, I think.
The right side. So we can do the left side today. Okay. So I'm gonna draw 6 units. can you verify for me, please? And we have sex here.
Yes.
Okay, thank you. Okay, Mr. White, so we're gonna do the just verify for the third time. Can you tell me your name and date of birth, please?
Glenn Light, I'm 67 years old.
No allergies?
No.
Any allergies? Okay. Right patient, right time, right dose. Okay, so let me just. And you also know that when you're at home, you just can clean your side with water and soap, right?
Yeah.
Okay. I'm going to give you a little pinch. How are you feeling?
It's fine.
Are you having any of the symptoms of hypoglycemia?
No, I feel fine.
I'm going to wash my hand. And I also print for you the American Diabetics Association diet. And then you can have it, and it tells you some other options or calories and everything. So if you have any questions, you just let me know. Your call light's here. Is anything else that I can help you today?
No, that's it. Thank you.
Okay, so I'm gonna. Okay, got the glue. Just let me know if you need anything, okay? And then your meal is coming. Okay?
Thank you.
Okay. So, very good, Michelle. I do have a couple more questions here. Were there any pertinent pieces of information you reviewed before administering the client the medication?
We reviewed the blood glucose, if he was having any symptoms, how he was feeling before we administered the medication. And we document everything.
Okay. Did this information affect your decision to administer the medication?
Yes, because we need to make sure the blood glucose, everything before we give him the insulin.
Okay. Did this information affect how you administered the medication?
No, it's just where we're gonna apply the insulin, because he needs the insulin.
Okay.
And we just need to make sure that he have a meal right after, because it's a rapid insulin, so he needs to eat a meal 15 minutes after.
Okay, very good. Those are all the questions I have.
I'm just gonna finish document. You're more than welcome to observe me, okay?
Okay.